Face masks certainly have become part of the new normal for protecting ourselves and, of course, those we love. So joining me now is Dr. Mary Clifton. She's an internal medicine doctor in New York City, and she's also a member of the Boomer Naturals Advisory Board. Welcome. Thank you for being here.
Well, thank you for having me. It is important to be thinking about how we're going to integrate face masks into our everyday life now.
Here in Connecticut, we've just started to reopen partially as of Wednesday. We're moving into the Memorial Day weekend, and everyone is being advised and required really by our governor to wear a mask in public. But that means you have to wear them properly for them to be effective, right?
Yeah, I think it's important to make a good selection on the mask. There's a number of different things that make a mask more or less effective. The American Chemical Society did a great study published in their journal Nano just this year in 2020. And there's three factors. Well, there's probably four factors, but it matters how much particulate is in it matters about the droplets, the number of droplets that somebody is secreting. So if there's a lot of droplets, you're going to need a stronger mask to not spread those around. But it also matters about the speed behind the droplets. If you're just breathing, that's one thing. But if you are talking loudly, or even worse, coughing or sneezing, a good sneeze can fill a room with your secretions in less than 12 minutes. So, and the other major difference is distance. This 6-foot distance is very important, even if you're wearing your masks, to try to prevent a high concentration of secretions to get into your breathing space.
One sneeze can fill a room. That is something to think about. Now, we have been doing a lot of charity work with mask giveaways around here, but I know for some people it's still difficult to get a mask and to purchase a mask. You are working with Boomer Naturals, and your masks have some antimicrobial linings in them.
Yeah, we have a mask that's in stock and ready to ship. It helps to start with a one ply. I mean, with anything, a scarf or a bandana is better than nothing. But when you get into 2 or 3 plies of fabric, that really helps to create a little bit more filtration. And then I especially love the Boomer masks because they also have a nano silver technology infused right into the fabric. So that works as a natural antibacterial and antiviral, although we're really not allowed to make that claim in the United States because all of that testing was done overseas. So we can't make that claim here, but we do have this treated fabric that has the 3 plies of poly cotton, and they're very comfortable and cozy to wear.
Yeah, people might not realize that because we are being told that if you can't buy a mask, just put a T-shirt around, you do anything. But the protection can really vary for as low as 2% to as high as, 60% for a regular type mask?
Oh, I mean, I have an example here of the N95s, which is our best filtration mask available. This is reserved for our frontline healthcare workers, and you can see it has this metallic thing around the nose so that it really helps to prevent gapping. And when an N95 mask is properly fitted, you're going to see a reduction of upwards of 99% of particles are going to not be able to pass through this mask. But if it is improperly fitted and there's a gap, it's so difficult to breathe through this filter that if there's any gap, the air will just whoosh right in through that gap. And the value of this mask goes down as low as 12%, just like that. So you really want to have a mask that not only is comfortable so that you'll wear it, but that's also breathable and easy to talk through. So I like the Boomer mask because it's easy to put on. You just put it over one ear, cover your mouth and nose, and then check it for all of these gaps. It fits really far back and nice and high and low. So when you breathe, if you can see how it moves in, like the air that's coming into my mouth is coming directly through the mask and not through a lot of gaps around the mask. So that means that it's really helping me to filter. And then it also covers my face holes, so I'm not likely to touch myself on my mouth or nose and end up, inadvertently giving myself an exposure. And then when I'm done, I can just take it off with one ear loop and the other, You can hand wash it in the sink for 2 minutes and lay it to dry, or you can sanitize it if it's not too dingy just by putting it in a paper bag in the oven for 20 minutes at a low heat.
Okay, so 20 minutes at a low heat. I don't know if you know anything about microwaving. So I've heard some people say, oh, they're putting their masks in the microwave. I don't know if that's a good idea or not.
I've heard about microwaving, and I think I'm more comfortable using the oven until I've actually seen some data on sanitizing through the microwave. But it makes sense because the microwave is going to zap the zap the virus. But I
Okay.
don't have data to share with you yet.
What about our children? I mean, here in Connecticut, it's very likely, according to recent reports that I just did, that our kids are going to have to wear masks when they go back to school. And I find that if I just bring my kids to the grocery store, they might fidget with it. It's not the most comfortable thing. What do you advise for the children?
Well, I think the children are looking at us for how they should behave. So it's always helpful to, eat your vegetables
Right.
and go to bed without a fuss and wear your mask without a fuss. And then Boomer has these very cute little children's masks that I sent to my grandkids. They're sweet, and this has been kind of a fun thing for them to have. In terms of getting used to this, so they don't look like they're from the doctor. They just look like another part of their wardrobe. So I think if we can handle it well and remind them that we're protecting other people, but we're also protecting ourselves. I mean, using a good three-ply fabric, especially a treated fabric, and making sure that you're maintaining a good distance, does provide a significant amount of protection. I mean, so much so, I've been wearing masks for 20 years on and off for various surgical procedures in the course of my medical practice. I don't think I'm going to go through another flu season for the rest of my life without a mask in place. When you realize that these conditions are transmitted by inhaling somebody else's secretions, it's pretty gross. It makes sense to just protect yourself.
Yeah, okay. And, when we're seeing about people buying them on random places online, which sometimes can be very expensive, you think where we buy them matters. I mean, I've seen all kinds of things at the grocery store, from just throwing a t-shirt on or a bandana, but these boomer masks that you're talking about provide, you think, more safety.
Oh, absolutely. I mean, all of the research would definitely back that up, that one ply is better than nothing, just a t-shirt or a bandana, but it's really not much better. And the other problem you're going to get is moisture. When you humidify the fabric, it makes it easier for particles to cross over the fabric layer and actually be found on the inside of your mask. So when your mask is a little bit thicker, it allows for those particles to stay on the outside. And that's the other thing I do. If you're out running around, running your errands, and you're doing stuff and you have your mask on in and out of your car, or you skip through the park in New York City to get to your next errand, you can just put your mask down if you're not near a lot of people. And then that will also help to dry it out so that when you're ready to use it again, you can pop it back in place and it'll be nice and dry and doing a really good job with filtration for you.
What about taking it off? And also, sometimes you'll see people, it's just uncomfortable. They move it down so their nose is beyond the mask. That's a no-no, right?
Right, because it's the face holes that you want to cover to reduce the risk of getting the virus into your system. So if you're in a situation where you need to wear it, you should wear it over the mouth and nose and watch those gaps. And then when you're not wearing it, you can pull it down. Or some people, I've seen them hang it on their rear view mirror in their car. That's a good idea too, as long as your mask is really clearly inside and outside. Then that's a very safe thing to do too. But then when you get back into your apartment, that re-entry procedure can be a little disorganized. So the best thing to do is just go straight to the bathroom and manage your mask, get things cleaned up. If you're not going out again that evening and you won't need it, you can get it washed with soapy water for 2 minutes and hang it so it's ready for the next day. Or if you're going to need it in a little while, that sanitization in your oven on the lowest temperature for 20 minutes in a paper bag is also helpful. And then make sure you wash your hands carefully and then turn your attention back to the items that you brought home with you. I keep a distillation of bleach disinfectant, just like a tablespoon in a squirt bottle, and make sure that I can disinfect everything with a clean cloth before I bring it into the home. The risk there really is low. I mean, the risk of something being transmitted through your groceries or through items like that. But it makes me feel better to just move through a process, with reentry. I mean,
Right.
paper like your mail or cardboard boxes, it appears to only allow the virus to survive for 48 hours. But doorknobs, plastic, glass, there's quite a bit longer duration that the virus can live on those surfaces. So, potentially you could transmit from those surfaces. So it's helpful to just do an extra sanitization of your doorknob and the area around your doorknob, every day or every couple of days.
Yeah, that makes sense. And as far
Mhm.
as these masks, do they wear out?
Oh, yes. Well, after 30 wearings or 30 washes, they lose some of their efficacy. So they last for 30 days, which makes them very affordable. They're only about 30 cents a day for these masks, and they're so much more comfortable and easy to wear than a surgical face covering.
So they're available now. Some people have been asking. I know we're doing
Yes, ma'am.
free mask giveaways at certain places, but if people are wanting to order and they have the means to do that, then they just go on your website if you let people know what that is, and they can find out more about the Boomer mask and order them right to their home.
Yes, ma'am. It's boomernaturals.com. And I think you can use TV20 to get 20% off on your order.
Oh,
And they should ship in the next 24 hours. They are going gangbusters to ship these out as quickly as possible. The masks are actually brought in from Vietnam, and Vietnam has had a excellent rate of coronavirus infections. They're doing an amazing job of controlling the problem in their country. But they use these masks for not only their healthcare workers, but also for individuals. And they're
right.
having nice results. So it's exciting to be able to share a great product that fits well and is comfortable that really everyone needs.
I know some people who are on the feed are just, I want to ask that question. It says, explain how masks really work. I mean, some people want to know just for the information. Some really don't want to wear
Yeah.
them, so they need to be convinced.
Yeah, I appreciate that you're checking the feed because it's hard to do one of these and also check. So thank you for doing that. So the most of the research on masks has been done prior to the coronavirus outbreak, just looking at medical environments where we have a patient in the hospital who could potentially transmit their infection to us, somebody like influenza or tuberculosis. And the studies have involved two mannequins, like the sick mannequin lying in bed and the standing mannequin who is helping the sick person lying in bed. And then we've put a mask on the mannequins, or a mask on one and a mask not on the other, and then tried to see what the best outcomes were. And then we've also had the sick mannequin either breathe with a high level of particulates in the breath where there's a lot of secretions, or where there's a smaller amount. And then looked at various types of masks and various distances between the two mannequins, and tried to figure out exactly how much of those particulates are getting into the healthy mannequin. And the best outcome here is when you have, of course, both mannequins with a good mask in place, with at least 3 layers, or preferably 3 layers of fabric that is tightly woven, so that it restricts the ability of these secretions to escape into the room and then have to land on the mask of the other person. So, and you can imagine This is not something I'd like to see you do, but I have seen it. And I always feel bad when it happens. But when somebody sneezes or coughs into their mask, it's, you can see the mask sort of gape a little bit where it's containing the secretions and not allowing them to get into the open air, which is just such a relief when you're a healthcare worker dealing with somebody with a highly infectious condition. Now, we have people all over the country that are getting sick with this pandemic that doesn't really appear to be letting up and is probably going to be increasingly problematic as the summer cold viruses come on, and especially when we're in flu season. Then things can become more worrisome. And people can get sick for up to 14 days and not even realize that they're contagious. So you could be talking to someone who looks perfectly healthy and they're actually transmitting virus. It's a very smart thing for the virus to do, to have this long incubation period. So it's important, even if you feel well, to protect other people from your secretions by putting a mask on.
And one more request from the feed. They would like you to repeat the coupon code in case someone wants to order.
Sure. I think it's TV20, but do you have the code with you? But if you don't get that code, you could always email and just tell them that you have the code. I think it's TV20.
Yeah,
almost
you know what?
sure.
No, I appreciate it. And you and I'm here to get the information out, and you're here to explain it from a medical perspective. I got to be honest, I don't know if I see the code until you mentioned it, but hey, it's worth a try. You can say that you were watching this Facebook Live and mention that you were listening to Dr. Mary Clifton on WFSB's Facebook page and wondered if you could get that code. But again, you can order it at boomernaturals.com, and they do have for the whole family, I guess. And the problem for people has been finding them in stock. So right now you're saying, doctor, that if people want to order, they are in stock and they're shipping quickly.
They're in stock, and they cover all of the issues that you want from your mask. They're 3-ply. They have a special treatment to the fabric to add to the benefit of the filtration, and the fit is very comfortable and good for preventing that gapping that's going to reduce the value of the mask. So for you and your family to protect yourselves, wear the mask and maintain that social distance. There's nothing better than staying home and staying out of everybody else's breathing and sneezing space. But when you have to venture out of home, it's a great idea to have a mask you can trust.
Absolutely, and I know it's important because we are wearing them here at Channel 3, and I thank for the people who've, I'll show you mine, it's not a Boomer one, but people have made them for us. And
it's not as...
I didn't know about that until I started talking to you, but I know from wearing these all day, I'm in a room by myself right now, so I don't need to wear it here, that if it's not comfortable, you want to fiddle with it, you want to take it off, and that kind of defeats the purpose, because then whatever germs are on here, if you're taking them off, putting them back on, it's not the ideal way to wear them. So you do want them to be comfortable. So I appreciate you telling us about those, especially for those kids who are going to be tugging at them. And I know our governor has asked that people wear them. He's encouraging everyone to go outside, walk the trails, but have your mask handy in case you come into crowds this Memorial Day weekend, because it's a
really good idea. The majority, it's early data. We don't have a lot of data yet, but the preliminary data is arguing that most of the transmissions of this virus is occurring in closed spaces where there isn't good ventilation. Like one person who is infectious sits below the air conditioning at a restaurant, and even though he looks healthy, and then everywhere where that air blows, all these other people get infected. Or there'll be one person who is sneezing and coughing in a room, and then everybody else in the room becomes infected. There was an interesting case report about a choir practice where one man who was feeling good came to choir practice, but everybody was singing, and that adds so much velocity to the respiratory droplets that everybody got sick in the choir, because this is a very sticky virus. So It's in these closed spaces with poor ventilation. It's super important to think about the drafts and the way that the wind is moving. Make sure you throw open the windows to add that ventilation. But the very best thing to do is just be outside, because then you're distilling this virus into basically an infinite amount of airspace, and that will help to substantially reduce the risk. But so if a runner runs by you and is exhaling quickly and they're not wearing their mask, I always have to reassure myself by saying, this is a very large airspace. That was one exhalation, and the distillation is pretty significant. And then I have my mask on. So, they probably didn't cause me any harm. So there's a lot of that self-talk and reassurance that we're all having to do right now, because this is a very scary time. But if you have your own really good mask, then you can relax a bit into that and keep yourself out of these poorly ventilated enclosed spaces where transmission risk is highest.
Absolutely.
Like bars, for example. We really do not want to be in a crowded bar where everybody's inhibitions are down and nobody's wearing a mask, and people are, getting their secretions all over the place.
Yeah, I hear you. I hear you. Well, the bars are still closed in Connecticut. I know some people want them open as soon as possible, but you raise a good point. So, Doctor, thank you for sharing some information with us. And if you're listening, or you have a friend who's listening and you're wondering where to get a mask, there's a lot of information right here in this feed. So, Doctor, thank you so much for being with us.
Oh, thank you for having me. It's been great.
Have a great Memorial Day weekend.
You too.
And again, here's the information. It's boomernaturals.com. You can check out the masks that we were speaking of right there.